feel of your belly, feel of your legs, take your pulse, this kind of thing. I'm not going to be feeling of you that way. Okay. So explain if they ask a question what you mean when you say you're going to be feeling of it. But in order for me to do this, I need to raise your bed up a little bit higher because it's a little bit low for me. And get my rail down. Before I put this rail down, can you scoot toward me to the closest to the rail as possible? Because I'm going to be leaning over the patient, and if she's close to me, then I am not in the middle of the bed, then I'm not having to stretch so much, and it's easier for both of us to do this assessment. So right now we're on
page 2, I think.
I'm sorry?
We're on page 2.
Okay,
Halfway down page 2.
halfway down to page 2, okay. Yes. Actually, well, we're on page 1, appearance and mental status. Level of consciousness, is this patient awake and alert?
Yes.
Yes. Do I need to go through all of those questions then?
Do we have to verbalize those anyway for the checkoff?
Yes. Now, one of the things that I know that you've had happen to you many times since you've been here is I have to identify you. Can you tell me your name and your date of birth? I need to look at your armband when you're going through that. What is your Shirley?
July 18, 1971.
Okay, thank you. And it matches with my paperwork that I have here, okay. I know you get tired of that, but we have to do that because, believe it or not, there's more than one Sean Franklin. I came to work one day and they had this big billboard up there that says, Anna Dye. And I thought, what am I doing up here? And then come to find out this other Anna Dye is a realtor. She sells real estate. I thought, boy, I wish I had her money. We have to do that because there's usually more than one person by that name. Okay. So we've found out why she's here. Now we're going to ask her if she has any pain. Are you having any pain when you bleed? When you came to the hospital, on a scale of 1 to 10, with 10 being very, very severe and 0 being no pain, when you came into the hospital, where would you rate your pain on a scale of 1 to 10?
6.
And right now?
2.
Okay. When you're doing an assessment on pain, what was it initially and what was it now? And we know she was having pain in her chest because she was admitted with asthma. Okay. Now we're down to page 2. I lost my page
2 assessment.
I lost my page 2, okay. Vital signs, I'm not doing vital signs, but that you will get tomorrow. You'll get that another day. I've got her bed adjusted. Going over now to her skin, hair, and nails. Now I'm going to put my side rail down. All the time I'm doing this, I'm going to push this rail in against the bed so that I'm not bumping into it. One of the things that I like to do, Ms. Jones, is I always like to put a towel across the woman's breast like this. Because even though I have the bathroom door open and the curtain drawn, sometimes people can still work their way around. The other thing I like to do, if you don't mind, I'd like to put this over the top of your gown, and then will you spread your legs for me? Tuck this under your buttocks area so that you are covered with your pubic hair. Everything here is covered in case I have to move your gown around because I don't want to expose you in any way. Her breasts are covered, her pubic area is covered. And I jokingly tell her, this I call my Indian jockstrap. Kind of get them to laugh a little bit. The Western movies and how the Indians wear this jockstrap. Well, the women don't wear that, but I use it for everybody. Now anybody can come in, and no matter what I'm doing, she is not exposed. This is one of the things that you want to make sure of if you're maintaining privacy. Okay? So now I'm going to start with your head. I'm going to feel of your hair, look in your eyes and your nose and all that kind of thing. I'm going to feel of her hair. Around behind her head. While I'm behind her head, I'm feeling occipital lymph nodes. Occipital lymph nodes, the ones behind the head, will normally only be found in children. I'm going to swing my hands around up to the temporal region. You ever have headaches?
Yes.
Anything here? Migraines?
Yep.
Yeah, right in through there, okay. Well, I'll try not to irritate you. Rub my fingers around, feeling for the pre-auricular lymph nodes, back behind her ears for the post-auricular lymph nodes. Under the chin, raise the chin up, and then under the chin, submental, feeling for lymph nodes. While my hands are on her head, my hand is going to go up here, one's under her chin, one's going to her forehead. On her forehead, I'm going to be placing a thumb and a finger over her eyes. One finger on one eye, one thumb on the other eye. I'm going to be looking in your eyes now. Okay? When I turn my light on, I will be looking one eye at a time. And you, again, when you're doing your bed bath, any of your procedures, you go to the farthest one away first. I'm going to raise up her left eyelid. Before I do that, the reason I have her eyes closed is because this ambient light in the room. You will not be able to see eyes dilate if you've got all this light in the room, because they're going to be constricted. And then you shine a light in, and you're not going to be able to see any difference. But when I close her lids and keep them closed from the light, they will dilate. When I put the light in, then I will see her constrict. Okay. One at a time. Beautiful. And over, and the other eye. Now, if you want to look for if there is any possibility of brain injury, what you will do is you can then look at the eyes on either, open your eyes. But I don't expect you to do that. I just want you to be able to see the pupils dilate and constrict. The darker the pupil, the harder it is to see the constriction. So what I want you to do is I want you to practice on lighter colored eyes first. So see what you're looking at, or else get into an area that's quite dark and watch it, how it will open and close until before you go to other eyes, because it takes a while. It takes a lot of practice to see that. And then my hand is still on her forehead. I'm going to bring my thumb down to her nose. I'm going to look in your nose now. Are you having any trouble breathing?
No.
Not through your nose. Okay, you had asthma, but it was mostly you were breathing through your mouth. Is that what you were doing?
Yes.
Okay. Now I'm going to take my tongue blade and I'm going to look in her mouth. This is the handle I'm touching on this end. This is her water. When you put a tongue blade in a patient's mouth, it always works better if you put it wet first. A dry tongue blade will make a patient gag, because it will stick to the mucous membranes. When you pick it up, you're going to make them gag. So if you just get it wet before you put it in the mouth, there's no problem. Can you open your mouth for me, please? Okay, can you say ah? Ah. Beautiful. Okay. Now when I'm looking in the mouth with this wet tongue blade, and a dye always has an oops. I want to look in the buccal pouch by pulling this little pigeon pouch out, looking down on the gums, and accidentally touch the gums, looking over this side, and then when I'm up in here, I'll hit the gum accidentally, and I'll say, oops, I bumped your gum. What am I doing that for? I do it on purpose.
Your test is sensitivity. If it's what the dentist does.
The dentist does it too. What are they doing it for? Gingivitis.
Yeah.
I'm looking to see if her gums bleed,
Yeah.
because it either is a sign of gingivitis or it's a sign of bleeding disorders. If her gums have a little oozing, I'm going to say, have you been to the dentist lately?
Yes.
When was your last dental appointment? Your teeth are in excellent shape. You have every one of your teeth in place. I don't see any dentures. How long has it been since you had your eyes examined?
A year ago.
Do you wear glasses? Sometimes.
Yes.
Okay, now you're going to get this same kind of hesitancy from your actual patients, and that's okay. Okay. I've done her head, eyes, nose, mouth, lymph nodes. Now I'm gonna do her sinuses. Okay, I'm just gonna tap your sinuses. This is called percussion, by the way. Does that cause you to have any pain? That? If she has a sinus problem, vibration will cause pain. So this is just all I'm gonna do to that. Also, I wanna look at your conjunctiva. Nice and pink. Nice and pink. Now I'm gonna look at her neck. All I'm gonna do is just slide my fingers down. See if the trachea is enlarged and make sure that the trachea is in midline and that her thyroid's not enlarged. You can tell that by looking. That is head and neck. That's all you have to do with head and neck. Now you can either do the arms or the chest. I like doing the arms next. Let me see your hand over here. Can you squeeze my hand? Good. Push. Okay. Pull. Good. Now turn your hands over. I want to see your palms of your hands. Always look at the palms of their hands because the palms of your hands are quite diagnostic about different disease processes. While I've got a hold of her hands, I'm going to do looking at her fingernails for clubbing, and I'm going to do the capillary refill. And again, the darker the skin, the more difficult it is to see capillary refill. But if her hands are warm, there's good circulation to her fingers, so there's no problem. If she had poor circulation, her fingers would be cold. So, okay. Now let me check your pulses. Give me your hand over here where I can feel them. Check bilateral pulses. Good, no problem. Okay, now I'm going to listen to your chest. Before I do that, I'm going to raise my tongue and I'm going to look. If it's a female, you want to always look at their breast. Now that I've looked, I can take her, she's got her gown off. You always will have this gown off. Obviously, she's got her clothes on, but you're patient with the gown comes off. That's why the towel's here. With my trusty little stethoscope, which I'm not going to put in my ears, I'm going to demonstrate to you. You have 5 fingers. You're going to use these to identify your landmarks. Your first landmark on yourself is below the clavicle. This is where you're going to hear upper lobe sounds. The reason you listen here is because you will tell me, open your mouth and take a deep breath. Where does the lung go when I take a deep breath? It goes up above the clavicle. So in that area right there below the clavicle, you will be able to hear me breathe. If I'm a little old lady all humped over like this with scoliosis, and you tell me to take a deep breath, this is where you still will listen. It's right below the clavicle in that little soft spot on either side. Open your mouth and take a deep breath. Don't breathe through your nose. Open your mouth. Now she has asthma, so I can't do a lot of this. You would only need to do 3 sites on the front. Upper lobe, middle lobe, lower lobe. Upper lobe, here and here. Middle lobe, 5 fingers, intercostal spaces. Rub, find your intercostal, rub your fingers back and forth. I don't care how big a person is, how much adipose tissue, you can feel the rib if you get to practicing. Right here is her middle lobe on the right side, right there. This is where I will listen. When I go over here and I come down 5 fingers, 2, 3, 4, 5. This is the 5th intercostal space. This is what's called PMI, point of maximal impression. This is where you should hear the loudest heartbeat. Now to get to the lower lobe, your ribs go out this way. Follow the sternum down to the axillary line, and in the rib cage, put your fingers in there, you can feel where the rib ends. Come up 1, 2, 3. And for women, it's almost right exactly where the bra sits. This is the lower lobe, intercostal space. Up 3. 1, 2, 3. One side, the other side. Okay. Upper lobe, middle lobe, heart. Lower lobe, lower lobe. One more time. Say it with me. Upper
Lobe, middle lobe, heart, lower lobe, lower lobe.
Now, if she's got respiratory problems and she's been having asthma attacks, taking 6 times is going to cause her problems. So you don't have to do it bing, 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 bing. You can do it a little bit, listen, you can change your routine, you can look at her fingers, you can look at her hands, then come back and do another lobe. But you don't have to do it all the way through at one time if they're having respiratory distress. Now I'm at her belly. I got my little towel here. This is at her pubic area where the hair is, and this comes up to her chest, to her breast. And how did I say you move breast?
Under.
Back of your hand. I'm going to move the breast back a little bit, put my towel under the breast. I've got full view of the abdomen. This is a head to toe assessment. So the reason, and the video even says most nurses like to start assessing on the right side of the lower abdomen. Where is the head of the colon? On the right side. That's where it starts, right? And it starts here and it comes up and it goes over here and then it exits. So this is where you're going to listen first. You're going to put your stethoscope here, and again you have landmarks on your own body. Feel this little point from your hip. There's a little point there that points in towards your belly. 1, 2, 3. 3 fingers over. 3 fingers over, that's where you're going to feel, or you're going to listen to the large intestine. Put your stethoscope here. You will hear bowel sounds if there's anything floating around in there. When you get to the upper lobe, you stop at the bottom of the ribs and come down 3 fingers. 1, 2, 3. And you listen here. This is the hepatic flexure. This sound is going to be different than that sound. Then over here is your splenic flexure. 1, 2, 3. And you listen here. This sound is different from this sound once you start learning how to differentiate sounds. Then you come down here and you come over 1, 2, 3, and you listen and you say, I hear gas. You're going to be starting to expel a little flatus after a while. Now please let me tell you, if you don't let this flatus loose, what we call gas, you can't go home until you let it out. So don't try to hold it. We're nurses, we've heard and smelled everything. So let it out if you want to go home. If you hold it in, your belly's going to start getting swelled up with gas, and then you're going to have a lot of misery, and outside going up here, you're going to be hurting out here, so just let it out. When was your last bout movement?
Yesterday.
Okay. You have any trouble eating with anything? Any problems eating?
No.
Okay, I saw on your chart that you're 74 years old.
Lord. You look good, girl. Moisturize.
What kind of medications do you take for your heart, or for your lungs, or for your bones?
Well, I take,
Again, I'm just getting information. I'm just interviewing and making.
well, I take albuterol for my asthma, and for my heart, I take the clonidine stuff, and what else did you ask?
Yeah, that's exactly what patients will do. Do you take any special calcium supplements for your bones?
Yes, I do, the calcium D stuff.
Okay, good. And you eat lots of foods that are rich in calcium and stuff like that.
Yes, I
All
drink
right.
milk.
Good, because that's important that you kind of protect your bones a little bit. Okay. Any questions on the belly? Now we're going to go to the But what I like to do on the bones, we didn't look at the thing on the thing because it goes into too much too detail. I like to come to the foot of the bed. Most old people have problems with their knees, right? So I lean over the bed and I put my hands on the knees and I close my eyes and I determine whether both knees have the same temperature. Because if there's arthritis in one knee, you're gonna feel the difference in the temperature. Then slide, don't pick up, slide slowly down to the toes. After you get to the toes, you're going to do the pedal pulses. You're gonna come in and do the pulses, or you're gonna come out here and do the pulses. Then you're going to ask her to bend her knee, gently squeeze the leg and toes to the nose. Does that hurt? This is Holman sign. She's been in bed for 3 days. If she has any kind of pooling of blood, potential for a blood clot, this is where it will show up, is in the calf of her leg. Toes to the nose. Does that hurt? Okay, thank you. Now, if you would, let me put this rail up. I'd like for you to turn over on your side so I can check your back. And the rail out, slide it up. Okay, can you turn over?
Well, I'm 74 years old. Try this.
Oh, you did that so well. Now, see, I still have my little jock strap here. I can make sure she's covered. But one nice thing about the back. Most people aren't really worried about whether or not you see the crack. You see that by all these guys walking around with their britches hanging down. Everybody
Not
has
cute.
one, right? So they're not real worried about that part. Everybody has some of the front too, but they don't want to show that so much. So they're not really that concerned about the backside. You're going to listen to them breathe. You're going to look at the bony prominences. You're going to check their heels. Is it easier to check your heels when they're on their side or when they're laying flat on their back? On their side. So I'm going to listen to her. Now this time, when I'm listening to her breathe, I'm only going to listen to 6 places. And I'm not necessarily going to have her to take 6 deep breaths every time. Turn around. Put your hands behind your back. Okay. When she does that, you can see where her scapula is.
Yeah, we can't all see. There you go.
See where the scapula is when she's got her hands back here? The spinal column is between the scapula. If you put your stethoscope on the scapula and try to hear breath sounds, you're not going to hear a thing. So you have to be able to identify where the scapula are and then listen on either side of the spinal column. And it spreads, so you go 1, 1, 1, 1, 1. According to your book, there's 6 sites on the back that you will listen to. She can either be laying down or she can stand up or sit up. The main thing you want to assess on the sides is the hips to make sure there's no pressure development here. Ulcers, sores, they don't call them sores, they're pressure ulcers. On the hips from pressure points, on the elbows, on the heels. Behind the ears, on the ears. Because a lot of people, if they lay in bed a lot or they have these oxygen tubes behind their ears get sore. So look behind their ears as well. Okay, thank you.
You're welcome.
You did a beautiful job. On your handout, on your checkoff, on your skills checkoff form, what did we omit?
The ears.
Ears. Okay, thank you. I did not look in her ears. What else? I didn't ask for allergies. Thank you. What else did I miss? This is my first assessment. I'm just a nursing student. Am I going to be perfect? No, of course not. So I've already missed 2 things. Does that mean I failed?
No.
No. All I got to do is say, oh, I forgot to look in her ears. I forgot to ask about her allergies. As long as you recognize you made a mistake and you verbalize it, I should have done this, or I forgot this, no problem. It's when you go bang, 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 and you say, I'm done. And the other thing, you missed the big one, all of you.
You didn't palpate
What
anything.
did we do earlier today?
Hand washing.
Hand washing. None of you caught me on that. This is a test. None of you caught me on, I'm supposed to be doing my hands whenever I go in and start working with the patient, right?
Right.
And that just went whoop.
I was wondering if we changed religion on their voicing or not.
But you never, nobody said a word to me. So I missed those three things, right?
Right.
Anything else on your list I missed? I'm a beginning student. I'm gonna forget a lot of things.
Respiration.
No, I counted her respiration. But you're gonna do that when you do vital signs.
Did you palpate her stomach?
Part of your vital signs. I'm not doing that with this.
You miss if Danny got a knee joint pain or.
I assessed her. I didn't ask her the questions, but I felt them.
Did you palpate? Did you palpate?
Yeah.
I heard her, I know she oscillated, but I didn't see her do the tapping.
Did I don't know.
So here, are y'all still asking her questions about this? 'Cause-
No, they're critiquing me. Tell me what I missed
Okay.
from their, but I'm done. We're done.
Okay, so what I'd like to do is to give y'all about 10 minutes, go to the bathroom, go have a break.